I think the majority of people with PN have a history of diabetes. And she is also a certified personal trainer through the American College of Sports Medicine. She assists people of all ages and backgrounds, managing their weight, controlling chronic health conditions. And her primary goal in her practice is to listen to the unique needs of her clients and develop a personalized plan so that they can eventually take full responsibility for their health and wellness. So I'm going to now turn this over to Miriam, and she will talk for about 35 minutes or so, and then we'll have a short break and she'll come back and answer your questions. And so you can put them in the chat or raise your hand when it's time. Okay, so you can take it away, Miriam.
Hi, everyone. Thanks a lot. Thank you, everyone, for having me today. I'm going to start sharing my slides and go over the slides, and then I take questions, as Joanne said, after the break. So can everyone see my slides?
Yes.
Yes. All right. So thank you very much for the introduction. Let's see what we are going to talk today. So the PN is something that you all are familiar with. I probably don't have that much to cover about the PN, but I will go briefly over that to say how we are going to start. Again, signs and symptoms, not so much time spent on that. Most of my time is going to be spent on the diet. Physical activity is going to be the second topic that I will cover. And then I will also go briefly on other lifestyle that contributes to PN. So when we talk about peripheral neuropathy, is basically any damages to peripheral nervous system. That is the system that sends signals between central nervous system and all other parts of the body. What is going to happen is your feet might be cold. We're going to see effects on your movement. It also can affect other organs. So heart, blood vessels, digestion, urination, all the other organs also can be affected because of that basically connection issues. And there are so many people in the US are affected by that. There are different ways that it happens. It could be loss of signals, that it feels like a broken wire. It could be inappropriate signaling when there shouldn't be any. So there is a static on a telephone line is a good example of it. And errors that distort the messages being sent. So like wavy television pictures. There are different severity of it. For some people it's mild, for some people it's very debilitating. And then for some people it might come and goes, or might come once and then they might not deal with it for the rest of their life. Or for some people it stays and gets worse over time. So what are some of the causes that we know? There are so many, but these are some that we know that probably are biggest contributing factors. So if you have if you experience any physical injuries, that could be a trigger for it. Diabetes is one of the biggest one. I guess when Joanne was introducing me, she mentioned something about that. It could be autoimmune disease. It could be kidney, liver disorders. Hormonal imbalances. It could be vascular blood problem that causes it to happen. The ones that I will spend a lot of time on is the nutrition or vitamin deficiencies, cancers, tumors, even chemotherapy that you might get as a result of cancer or an infection. Any of these factors are the most known factors that can contribute to the PN. So what is the bottom line that we need to know? when it comes to these lifestyle changes is we need to learn how to fight inflammation. And that means a lot of lifestyles needs to be changed. That being said, is we need to work on our eating. So that would be basically anti-inflammatory. We need to learn to manage our weight. The less weight on your feet, the easier you can walk around. Physical activity. If you have heard, if you don't use it, you lose it, is something we need to do. Despite all these limitations, we need to use our muscles as much as possible. Sleep is another one. We are in a society that might not value the sleep, but as I talk, you'll see there are so many things that we can do and we should do to help with that. Smoking is another big one. Alcohol is another one that we can do. And basically, we try to control our stress as much as possible. Let's talk about the first and foremost. When it comes to anti-inflammatory eating, there are so many resources online. And unfortunately, even some of them are from the places that we think that, oh, they are reliable, right? They are credible. No, some of those are not. And I can tell you why. Many times, many of these resources are written by people that they might not be experts. And they don't look at the credible resources and references to write these ones. So I know many people go and Google and find this is the anti-inflammatory diet to follow. But what is actually anti-inflammatory is something like a Mediterranean diet. The Mediterranean diet is one of the most researched diets that we have out there. And what is it based off? Most of the diet is very plant-based. Most of the diet is also from fruits and vegetables and whole grains that are hardly processed. They are unprocessed from scratch. Also, Mediterranean diet is high in healthy fats, being olives, being olive oil, being nuts and seeds, and so forth. Protein is also plant-based, meaning you're getting it from beans and legumes, from nuts and seeds, or from whole grains and vegetables. After the plant-based part of the Mediterranean, what we know is fish and seafood. The new name for it is blue foods, are the recommendation and what is happening. And by the way, the Mediterranean that I'm talking about is the Mediterranean that started to happen after World War II. It was the 1960s Mediterranean, not the Mediterranean that you go to any of those countries and it's opposite the Mediterranean diet that it should be. So the fish and seafood based on that Mediterranean from 1960s, and some of the areas in Mediterranean still might kept up some of that diet, requires you to have fish and seafood as your main source of animal protein. Less of cheese and poultry and eggs and dairies, and actually meats and sweets is less than once a week in the actual Mediterranean diet. So whenever, and then they might put different names, labels for Mediterranean diet. Oh, this is the anti-inflammatory diet from this place and that place. These are the basis of an anti-inflammatory diet. You need to work on the ones that are healthier in this diet, and you need to limit your meats and sweets. About the alcohol part, I will talk in the future or in the following slides. Even though it's part of the Mediterranean, we are still going up and down in the alcohol, and more research shows it's not the healthiest one, and the recommendation goes down on the alcohol part, as I will discuss later in the slides. So, and these people, another big part about the Mediterranean and being inflammatory is the physical activity part, which I'm going to also cover that part more so later. So these people walk everywhere. They hardly sit down. They incorporate physical activity as part of their everyday lifestyle, so they don't sit still as much as possible. So again, to make it a little bit simpler, Harvard School of Medicine also have this list. They have the list of the foods that are they are contributing to the inflammation, and the list that are contributing to anti-inflammation. So again, as I told you, the foods that are anti-inflammatory should be from scratch: fruits and vegetables and leafy greens, nuts and seeds, olive oil, fish, fatty fish are the ones that is going to help with fighting inflammation. And being PN, being diabetes, being depression, being rheumatoid arthritis, being Alzheimer's, they all are considered chronic inflammation. What is going to cause inflammation to go up is the ultra processed food, being fried foods, being fries, being sweet potato fries, being any soda, any sweetened beverages, juice, smoothies, refined carbs, lard, butter, processed meat. They all are basically the part of the whole group of foods that they are ultra processed that cause inflammation to go up in your body. Another big one that I get a lot of questions from, and I know it comes up on many of the websites, is, let me see if I can have this page. Okay, is the gluten. Okay, so is it going to help with the inflammation or not? So it depends, but let's cover it. Let's talk about it. What you need to remember is gluten is a protein. It is naturally occurring in wheat, barley, and rye. They are the famous one, and more. But for the sake of our conversation, let's just start with that. The people that should not have it is the people with celiac disease. They should not have it for the rest of their lives. If you have gluten sensitivity, we can talk more about it. It needs to be confirmed. So you need to run the celiac test, and then says negative on that one. But still, if you have some of the symptoms, we might suspect that you have gluten sensitivity. It's not so clear how to basically diagnose. If you have wheat allergy, you need to stay away from wheat. Not the other ones, but if you have wheat allergy, you have to stay just away from wheat. The dermatitis herpetiformis is another one that can confirm that, hey, you're better off to be away from gluten. One thing though, you need to remember, if for whatever reason, there's no reason that you stay away from gluten, this is what you're doing to yourself. We are staying away from whole grains. Many of the items that are gluten-free is actually fall into that ultra-processed food items that we want you to get away. So they are inflammatory. What we know is whole grains are big in improving our health, being heart disease, being diabetes, being gut bacteria, so having a healthier gut movement. Whole grains is a big part of it. And just a side note, the food industry pours billions of dollars into advertising for gluten-free products. Just from 2013 to 2015, they made about $12 billion in sales, which is the biggest purchasers of these products were the people who basically didn't need them. Another big question that I get is supplements. What we consider supplements is any vitamins and minerals, herbs, other botanicals, probiotics, fish oil. It could be protein shakes and so forth. There is basically no regulation whatsoever. Nowhere in the world, and it's not just the US, nowhere in the world, unless there's a big chaos and someone dies and someone has health issues, then you might see that they start taking it off the market. One thing that you need to know is supplements are not there to treat anything. They're not there to diagnose or mitigate or prevent or cure diseases. I get people that they don't get any treatment or cure from anything, and they start having a huge bag of supplements. Don't do it. One thing that you need to know, we have like 20% of liver and kidney disease can come from supplements. And because they're not regulated, who knows what you're getting? It could be something ineffective. It could be something poisonous. It could be medications that are off market and they are legal to be added. And it could cause so much more harm than being helpful. There are two that probably is warranted for many of you. Vitamin D, almost 90% of Americans need to be on some sort of vitamin D because we don't get enough sun and we're not out and about, and because of the skin cancer, we want to get away from the sun. So pretty much everyone needs to be on vitamin D supplements year round. B12, again, we need to see what the labs show. But many times as we get older, B12 absorption can be tricky. Another thing is we can be on all these medications that can cause vitamin B12 not to be absorbed. So we need the supplements in those cases. But still, you need to have someone in a healthcare provider society to look at your numbers, look at your situation, that yes, you need to get that. If you want to look up any supplements, what I would suggest is look at NIH Office of Dietary Supplements. Look at PubMed. These are reliable resources that you can get better information. But even in those cases, especially with the PubMed, if you find one article that says, oh, you have to do this because of that, that's usually not what we can refer to because it's so weak of a study. But if you have tens of thousands that they say something and one says opposite, then we might rely that, hey, that tens of thousands of studies is probably right, and we can go with that. The reason that I put this picture is many times if you want to look for the supplements that still to some extent might be reliable, basically what you're paying is what you're getting, is to look at these labels or these seals. But the best one is the USP, and I tell you why. USP is the same company that does the medication verification for FDA for the medications. And they look at the label and they look at the pills and say, what you're getting is what you're paying for. I got NSF, but it was just for gluten-free. So, hey, I don't care about the gluten-free part. I care about to know if this supplement that I pay is a vitamin D. So I'm just saying that these can help you to some extent to be smarter about your choices of vitamins and minerals and supplements. The big thing, as I told you, is the weight. One thing about the weight is we want to make sure that we get about 5 to 10% weight loss period every 6 months. That's what is doable. I have people to come see me and they want to lose all their weight in 10 weeks or this much, or on this wedding, this event, and so forth. Most of the time, their expectation won't happen unless you get a weight loss surgery, and you might even not be able with the weight loss surgery. So with the lifestyle change, you can expect 5 to 10% to be the best outcome. And what you need to know is going to help you in so many shapes and forms. That 5 to 10% is clinically significant for the health. It can help with the blood pressure, it can help with the blood sugar, with your cholesterol levels. Sleep apnea symptoms can be subsided because of the weight loss. If you have prediabetes, insulin resistance can go down. In many cases, the people that really do good with me, I suggest them to go to their providers and go down on number of medications that they have or the dosage of the medications that they have. And overall, chronic inflammation comes down dramatically in many of these people. And why it does that is much of the fat, especially in the abdomen area that we have, they produce inflammatory factors. And many of our health conditions can be attributed to these fat that we have in the abdomen area. So if we can lose the weight and get rid of some of these fat, we basically automatically also bring down inflammation. Joint pain also goes down, and then give me 1 second. Oh, the shortness of breath is another one that we might see. So you're going to be better off by losing that 5 to 10% of the weight. But how to lose the weight? I have a question for people. Does anyone have any idea what is the best way of losing weight?
Exercise.
Reducing portion sizes.
Okay.
Smaller plates.
So who said exercise?
I did.
That would be Gordon.
Oh, Bill, what was it you?
Gordon, at
No,
least
no,
one.
it was
Gordon,
Gordon.
Gordon.
It was Gordon.
Okay. Gordon, did you lose weight exercising before?
Yeah, during the pandemic, I lost some weight, and recently, about 6 pounds I was weighed recently. So partly because of my exercise. So
We will talk about it. How long did it take you to lose that much weight?
I don't really know because I exercise fairly frequently. I do a lot of bike riding, either indoors or outdoors.
Sure.
So I think maybe second year of the pandemic, I guess. It's hard to know, really. I just was surprised I had lost 6 pounds when I got weighed a week ago. So
Okay, we'll talk about it, and I tell you what has happened. But that's a good point, and that's a point that I'm going to discuss. But yeah, smaller portions, smaller plate, they all can help to lose the weight. With the exercise is a little bit tricky, and I will get back to you on why or why not we are not relying on that. So let's get back to the diet part. Just so you know, I know there is a lot of diets out there, and many people that they come and see me, they are diet doctors. They went from one diet to another one, to another one, to another one. So which one works better? Everyone is different. Many times I ask them, what worked for you? What would you like to do? I listen to what they say about lifestyle, about their limitations, about things that they like to have, things that they don't like to have. And then many times I help them to come up with something easy that is doable for them. But as I told you, Mediterranean is one of my favorite ones. But again, depending on the situation, I might suggest something for someone that might be more doable. One big thing that these days is very common also, people think that it's better to have a high protein diet, and we lose weight if we eat more protein, and we can do protein shakes here or there, and the weight comes down and the weight goes up instead. Or we do intermittent fasting, or we do ketogenic diet, which I'll talk about it. But honestly, just so you know, we lose weight as a result of cutting calories. So if we have a calorie deficit, that's how we lose weight. And they've done this study in 2009. Many of these people that they've done this study at the New England Journal of Medicine were #1 in the field of nutrition and obesity. And what they've done is they went up and down on protein and carbs and fat. And they compared these people for 2 years to see if someone lose weight faster or better than the others. No, doesn't matter. How you lose weight is you need to reduce calories somehow, somewhere. One thing that I have to mention before moving that I said about the ketogenic diet, one mistake that people make is when I talk about ketogenic diet, people think it's a high protein diet. Ketogenic diet is a 75–80% fat. Protein is not going that higher. If you're doing something high protein, you're doing Atkins diet, which is higher in protein. So, and that's totally different than Mediterranean. The similarity between Atkins and ketogenic diet, they both are lower in carbs, way more with ketogenic diet than with the Atkins diet. So let's talk about the get moving part. How it helps. So when I asked about the weight loss and you said about exercise, true, we lose weight as a result of exercise, but it's very slow. Most of the time, exercise helps with the body composition. Remember that I told you that the abdomen fat that we're worried about? Many times, if you exercise, do a lot of cardio, it can help to get rid of many of that fat in that area. So it's definitely something recommended. But it's very hard to lose weight as a result of exercise for a few reasons. One is your body learns to compensate for that calorie you're burning through exercise. So so you might burn 500 calories the first time that you do it. Over time, that 500 might get to the 100. And you can tell the physical activity is harder at the beginning. It becomes easier and easier over time. They've done controlled studies with people. They saw over the course of 6 months, people lost about 2 to 6 pounds. That's it. And just imagine that you're adding the peripheral neuropathy to the whole thing. How much physical activity we can expect you guys to do. So it's going to be very, very hard. And many people have other limitations. Even if you don't have it, I cannot run for certain times. And I might not have that limitation. So I'm just saying that it's very hard to push people to do more physical activity. We need to see what people can do. Anyway, what are some benefits of physical activity? It can help managing diabetes. We can actually, I use the physical activity as my cheat sheet. I tell people if you do physical activity on a regular basis, what you're going to see is your blood sugar is going to be managed better. So we're going to do it. Physical activity is big with maintaining healthy weight. But in order to do that, we need to get about 1 hour of walking every day for it to happen. So we need to push physical activity. You cannot eat whatever you want and expect the physical activity to work. I call it, you cannot outrun a bad diet. Still, the diet is the main part. You can lose weight with physical activity, but as I told you, it's hard. It might not be that much. It takes a while, 2 to 6 pounds, and you need to make sure that you're not compensating for that. People think that if they walk, if they get this many steps, now they can eat whatever. No. Let's say if you get 600 calories, you need to walk 3 hours to burn that 600 calories. So it's not possible for everyone to do 3 hours of walking. It makes people happier. The best outcome of physical activity is mental health benefit. It's right after the physical activity, and if you do it on regular basis, you get a double effect of physical activity on your moods. It helps with better sleep. That soreness, oh my God, that's magical when it comes to sleep. Plus that it helps with your breathing. You see that if you start walking or biking or swimming, you start to feel better with your breathing. It helps with the memory. We see huge benefits in elderly when they start to do more physical activity, and the cognition, everything can go up. They're talking about how much physical activity can contribute to you basically reversing your ages. The blood pressure is another big thing. The more we sit down and don't move, the higher the blood pressure can go, and it's hard to control. It helps with lowering your bad cholesterol and increasing HDL cholesterol. The good cholesterol, one of the only factors that we can use is doing a lot of physical activity to bring it up. So, what are the recommendations? For health reasons, 150 minutes of moderate intensity. If you do vigorous, half of that. That equals to this much a day. What can be moderate intensity? Any of these ones. Pick what you like. It doesn't need to be anything special. Go with what you like and enjoy. The other suggestion, in addition to that, that is very beneficial, is strength training. And then when we talk about strength training, people think that if they walk, they don't need any lower body physical activity. No, strength training is totally different than cardio. If you do these ones and these are your cardio, you need to do these ones for all your you need to add all of these to your you need to add all of these to your physical activity routine for them to work. Okay. So again, find something you like. You don't have to do certain things to count. Any movement can count. You can start with 5 minutes for every 30 minutes, 5 minutes for every, do something. Don't sit, move, stand. It helps if you bring someone else that can do it with you. And then have something in mind. Let's say this week, I can do 5 minutes a day. Next week, I go to 6 minutes. The week after, I go to 7 minutes. And put it in your schedule. Don't let the life happen and you don't get anything. Get something. Remember I told you about the sleep? It is as vital as food for survival. What is recommended is 7 to 9 hours of quality sleep. So we don't want it to be chopped up. Of course, medication, illness, pain can affect that. Sleep apnea, weight issues. Sleep is big when it comes to the learning, to the memory and mood. You know, many of the authors and artists and things like that, they get inspired when they are asleep. The person who wrote Frankenstein, he said, it came to my dream at night. So that's very important to get enough sleep. It helps with the heart health. People have better blood pressure when they get enough sleep. It helps with the hormones. The people that they get that 7 to 9 hours, their blood sugar are better managed than people that they don't get. We saw that people that get less than 7 hours, their blood sugar is all over the place. And don't get more than 20 minutes of naps throughout the day. If you think that you can nap throughout the day and get a quality sleep at night, it's not going to happen. So if you don't get naps, you're better off to get a better quality night at sleep. That is the most important part. The smoking, alcohol, and stress, yeah, they need to be stopped. They saw if you stop the smoking, you see a huge reduction in inflammation just in a few weeks. Alcohol, more research needed. They're going down and down on the recommendation. The last dietary guideline, I look at the scientific report behind it. They even went down on recommendation for men. Let's say if you are worried about the cancer, any alcohol can contribute to alcohol. So it doesn't matter how much, there is no safe amount of alcohol. And of course, chronic stress is another source of inflammation. And that's about it.
Okay, Marianne, thank you very much. I'm going to move things forward a little bit. I think
Sure.
we're going to take a little 5-minute break, and I've got 2:48 on my clock. And so if we come back at, let's say 5 minutes, we come back at 2:53, we'll start our Q&A. Is that okay?
Sounds good.
And people could go stretch and rest and check their food
Maybe they go
diets
5 minutes, walk around and come back.
Yeah,
right?
they can walk around, jump around, stand up, whatever. Anyway,
Sounds good.
I appreciate what you're saying, and we'll see you in about 5
5 minutes. Sounds good. Okay.
Thanks, everybody. See you soon. Okay, we're all back and refreshed, right?
Yeah,
Smiling faces. Everybody all right?
Bill, I've got a couple of questions from the chat, if I could start with those before you go turn it over to everyone else.
Okay,
Oh,
what
yeah.
I was gonna do is I've also looked at the chat and a lot of the questions are not, I mean, so the bottom half I see are related to what Marianne spoke about. Are you seeing what I'm seeing?
Well, I'm pulling out the things that are reference nutrition. I'm not
Okay,
looking at anything else.
okay, that's fine. Well, let's go with it. Okay, go ahead.
Okay, someone asked, how can you improve B vitamin absorption if you have pernicious anemia?
so pernicious anemia, if it's caused by, you need to increase your intake of B12. And if it's B12 related, but what if you don't absorb B12, then you need to get injection, which can happen because B12 is absorbed through a factor that we have in our stomach. When we get older, that factor might not work as well, or we might not have as much as acid that basically activate this factor in our stomach. So in those cases, we need to get B12 injection. But again, your provider is going to run the test, see what your B12 levels is, and then go with that. If it's pernicious anemia, is because of B12 deficiency.
Okay. Someone asked about the app MyFitnessPal, where you list total food consumptions per day. Does that help with weight loss?
Yes and no. I tell you why yes and no. So most of the time, if you start tracking what you're eating, it's going to help you to make you more conscious about your intake, and then it might help you to change your food intake, and in that sense should help. Why it doesn't help is it's almost impossible to record a calorie 100% accurate. Even they've done this study in the dietitians, and I've done it one myself, is many times we might underestimate what we are eating. And if you look at MyFitnessPal, if you do it, let's say you put apple, it gives you 10 different options. Which one is the accurate options? And it becomes complicated if you eat out, if you eat at someone else's house, and then many times people think that if they scan the label, it should be accurate, right? But I've seen that I scan it, my food label says 100 calorie, MyFitnessPal says 80 calories. So it's almost impossible to do 100% and rely on that. Your best indicator, if you're doing right with your weight, is the scale and weight on the scale.
Okay. What do you, is turmeric really an anti-inflammatory, and how much should you take if you want to take that?
Yes and no. I'm sorry. In many cases, I say yes and no. Remember that I told you about the problems with the supplements? Yes. So many times these supplements that you see in the market, they might not have those labels that I told you. The problem is we don't have enough evidence that show that turmeric is definitely anti-inflammatory. The third problem that we have with turmeric is that substance, that chemicals in a turmeric that is anti-inflammatory is very volatile, meaning that it won't last that long. So if you make it into supplements, many times it might not have that that substance, that chemical that is anti-inflammatory, because it's already basically gone. So basically you get something that you think that might help, and it might basically just bogus, nothing effective.
And probably different things help different people.
Well, correct. What I'm suggesting is hey, go get the fresh turmeric from the grocery market, from HMart, from the Asian market, and add it to the food. That's your best bet.
Okay, someone asked, what supplements can possibly cause liver and or kidney disease?
Any can do, as long as they're not regulated, can. And with some of the people, with some of the people, when we have the liver enzymes going up, or when they have a kidney disease, we actually stop most of the supplements, if not all.
Someone asked about fish oil capsules. Do you recommend those?
I do recommend them in many people that I feel like they don't get them in their diet, because they have a certain kind of fatty acid that we hardly get otherwise. That being said, though, remember those 3 labels that I showed you? I get the ones with those 3 labels. And I'm not into advertising for anyone, but many times I get my supplements or the supplements that I give to my loved ones from Costco. Costco is really good with having that USB seal that I showed you. So as simple as I don't go to Whole Foods or Amazon, any other places. If I have Costco, if you guys have Costco or someone around you, those USB sealed supplements are great at Costco and has the best price.
Okay. That's all I've seen so far.
Some
So
people
maybe-
ask about physical activity, I assume.
Yeah. Some, yeah. Not specifically, I think.
Okay. Yeah, so if anyone has questions, I'll be more than happy to answer those questions.
Anybody want to ask questions? Just raise your hand. Miss Pat?
Miriam, would you talk a little bit about sugar? I know that I have issues with inflammation beyond peripheral neuropathy. I was just actually in the hospital for a pulmonary embolism. And
So, Pat,
Fine.
remember when we were talking about the Mediterranean diet?
yes,
I said the sweets with sugar, added sugar is part of it, is less than once a week. And when I say less than once a week, I'm not talking about a whole cake less than once a week. I'm just saying a small individual portion.
Yeah.
But one thing that you need to know, many times we don't differentiate between sugar and ultra processed carbs, white rice, white bread, white pasta,
mhm,
and some other sugars that people think they are healthy, but they're not. Examples are honey. Examples are maple syrup. Examples are fruit juice. Example are agave nectar. Examples are brown sugar and cane syrup, organic something. So many times these are all the same kind of a concept. American Heart Association has a recommendation for women and men on daily basis.
Hmm.
So they said women need to limit their added sugar to 25 grams a day, which is about 100 calories. And then men, 36 grams a day, which is 150 calories a
I'm
day.
sorry. Could you repeat the women, please? I didn't hear it.
25 grams,
Okay,
and men, 36 grams.
gotcha.
World Health Organization also has the same, but World Health Organization across the board says 25. I think that they take care of men better than the American Heart Association.
All right.
Miriam, are you saying that honey and is just as bad for you as white sugar?
It is. It's half glucose, half fructose. Most of these things are half glucose, half fructose. The only exception is fruits. They are also half glucose, half fructose. But when you get fruits fresh, it comes with so many health benefits and so many other factors that doesn't cause inflammation. And it's actually on top of the list of the health. But even if you do fruit juice, it's the same thing. If you do fruit juice concentrate, it's the same thing. If you do smoothies, it's the same thing. But if it's fruit on its own, not touched, you basically eat it the way that it is, different.
Okay.
Thank you. And I'm
You're
going
very welcome.
to
Someone,
an add on quickly. I
Sure.
want to comment on the exercise and starting small. After I
Mhm.
left the hospital, they told me 15 minutes walking the first week and add 5 minutes each week thereafter. And I'm up to 25 minutes and finding it
Excellent.
fine. But I mean, that's still a far cry from an hour a day or,
So remember, Pat, the recommendation for the health is different than 1 hour a day. So recommendation for health is 20 to 25. but they said do whatever you can. Despite the fact that that's the recommendation, they said start wherever you can, do whatever you can. The 1 hour that I told you is a maintenance goal. And many times people can use it to lose the weight, but basically it is, it differs from one person to another person.
Okay, thank you.
Someone asked, what is the best way, or is there a better way to manage LDL and HDL?
Okay,
Uh-oh.
very different. That starts a whole can of worms. Remember, Peggy and Margie also have questions for me.
Yes.
So for LDL, the best way, there are many factors, but the main one that we are looking for is to basically limit saturated fat and trans fat. And that being said, meaning to limit any animal products, whole fat dairy products, cheese, coconut oil or coconut products, and palm kernel. And for trans fat, whenever you see on the label hydrogenated, needs to be limited, both for HDL, good cholesterol, and LDL. So that's the main factor. We used to say limit cholesterol, that is up in the air. As far as the HDL, that's the interesting part. These things helps with HDL, with triglyceride at the same time, and actually with the blood sugar. So these things are this: physical activity, limiting ultra processed carbs, white rice, white bread, white pasta, sweets. And the third one is weight loss.
Okay, thank you. Peggy Barton has had her hand up for a bit.
Okay,
Unmute.
yeah, okay. I actually wrote this in the chat, but did you say that palm oil and coconut oil are bad or good?
Bad.
Bad, okay.
And anything with coconuts, just so you know, it's not just the oil, even the coconut itself. They
Really?
all causes your cholesterol to go skyrocket. Don't do it. So many people that they become vegan and they think that they do a service to themselves, they see that the cholesterol is going skyrocket. So don't do it.
Wow.
Could you say again, I kind of freaked out when you said once a week with sugar. Can you repeat how much sugar I'm allowed a day? Like is a piece of candy?
25 grams of added sugar for
Okay.
women.
Okay, so you're not counting, are you counting like white spaghetti and white bread too?
No, this is the American Heart Association. We don't count them. But if you're looking at the Mediterranean, we don't recommend that white rice and white. You know,
Okay.
here's the thing, Peggy, we do have different guidelines depending on who you're listening to. If you're listening to Mediterranean, they don't recommend any white rice and white pasta. They say everything needs to be whole grain.
Mm-hmm.
Dietary guidelines says, oh, it's okay. Half of it is processed. But honestly, dietary guidelines many times is affected by the food industry. So I would not like to use it as much.
So I
it's
can
not
put,
so much research based.
so I can put like a teaspoon of maple syrup on my oatmeal and that's okay?
That's fine. Yeah, you're within the range.
Okay, could I ask one more question?
Sure.
If I'm 90% vegetarian, should I really be taking B12 complex supplements?
One thing that you could do is depending on the type of the vegetarian you are, and if you're getting any food that is fortified with B12.
No.
So that so there are some cereals that is fortified. Also, nutritional yeast is fortified with B12. So your best bet is to discuss that with your provider and have them run a test for B12.
Okay.
To be on safe side, yes, but the better approach is to see what your primary care physician gets from the labs.
Okay,
So
one
you
last,
were-
go ahead.
Oh, I'm sorry. So when you were talking about coconut not being good for you, I had to confirm whether it was a fruit or not, and it is a fruit. So you were saying that a coconut,
Everything.
right? But
Everything.
so yeah, are there other fruits which may not be good for you for various reasons?
So coconut is not a fruit. I mean, it in your terms is fruit. As far as nutrition, we don't consider it fruit. We consider it a fat. And we consider it an unhealthy fat.
Okay, I was looking up. It did say, I just Googled it. It says that it was a druid, a true fruit.
Yeah, so
Yeah.
we can say Google, Dr. Google, and I
Okay.
know many people are relying on Dr. Google, but many times it can be misleading and the whole show can be run by food industry,
Well,
which I
yeah.
so
That's
they
good to
bring-
have an expert on. Thank you.
Yeah, so they pour billions of dollars to advertising for things that is not healthy, to be honest with you. And
Okay. Well,
the health authority, the experts and nutritionists, we hardly have that much money for advertising.
well, so back to my original question. Are there any fruits? Are there any fruits that you would not recommend?
As long as they are fresh, I recommend them all.
Okay. Thank you.
Margie.
Margie has her hand up.
Yeah,
She's been
Margie.
there for a while.
Margie, is your hand tired? I'm sorry.
No, it's my virtual hand is up. In terms of the Mediterranean diet, I was alarmed to see that at the tippy top almost was dairy products, cottage cheese, etc. I have osteopenia and need to keep calcium up in my diet.
Okay, Margie, here's the big thing that you got. All right, hey, don't get mad at me. Here's what we know about the European and American diet. We have the highest calcium intake. We have like 1,000 to 1,200. And actually the guidelines that we have, the recommendation is not based on requirement.
Mhm.
It's based on average intake of the population. That's why it is so high. Have that in mind though. The way that the calcium is with the dairy products, the same amount of calcium we're getting from the dairy products, we are excreting in the urine. So pretty much not that much is left. At the same time, we see in European and American, we have the highest incidence or prevalence of the osteopenia and osteoporosis. Whereas there are other countries that they get their calcium from other resources, plant-based, from tofu, from beans and legumes, from nuts and seeds, and they might get much less calcium, and we see less osteopenia and osteoporosis. So Mediterranean still is considered the healthiest one, despite what you see that is different than what we do here in the US. And it's long ago, we're not, so it's hardly that we would recommend people to take calcium for osteopenia and osteoporosis. Now, our best approach is actually vitamin D first and foremost. And in many cases, you don't see the providers recommending calcium, and there are good reasons for that.
Well, I've been taking.
Repeat what you said to raise your calcium.
So to raise your calcium, you need to get it from beans and legumes, green leafy, dark leafy, green vegetables, and nuts and seeds.
Okay.
Those are better sources. The plant-based sources of calcium has more, they stay in your body better compared to the dairy products.
Oh, that's really interesting. I've been taking calcium supplements that I get at Whole Foods, and allegedly they're made from these dark leafy green vegetables. Do you think that those are valid, or is that kind of a hoax?
So does it have that seal that I told you?
I don't know. I'm downstairs and I haven't run
So-
upstairs to look.
Start with those seals.
Okay.
But if you definitely need to get some sort of, I actually get calcium because I don't trust myself to get enough calcium in my diet, despite the fact that I might. So let's say I don't do tofu on a daily basis. I do a lot of beans and legumes, green leafy vegetables. I try, not every day. So because of that, I get these calcium chewable from Costco that has those
Okay.
seals. And I got the same one for my mom.
Okay. All right. That's
But
good.
again, as I'm telling you, and that's because I don't think that I hit that 500 that I know in those countries that they do better and have no osteoporosis. I doubt that I do from my diet.
Mhm. All right. Thank you very much.
Not a problem, Margie. Great questions, though. Everyone is asking so many good questions.
Anybody else have questions? Please raise your hand.
Mike Foxworth has a question, and
Brenda,
so does Brenda and Gordon.
okay.
My question was, I heard you mention raisins. I've always seemed to have anemia all my life. So I took raisins. Did you say raisins were too high in sugar?
So Brenda, I don't remember I said the raisins, but here's the thing. Anemia because of what? You need to figure out if it's iron related or if it's B12 or folic acid. That's the first thing. So not iron, raisins is recommended for all the anemia. That's the first thing. The second thing is for women and men, if we are not at the age of, if we are at the menopause age, we should not have an iron deficiency unless we are losing blood somewhere. So what I would suggest is you need to figure out, one, what kind of iron deficiency or what kind of anemia it is, if it's nutrient related. If it's not, you need to figure out how basically prevent that from happening. Can raisin be a good source of iron? Yes, it is one of the sources, but we do have many more iron sources that we can talk about. So figure out what kind of deficiency you have before prescribing.
And are you saying raisins are high in sugar?
Raisins are high in sugar. Do I suggest people to go have, instead of fresh fruits, have raisins? No, I would suggest not to, especially if the blood sugar is something that we are watching. We're not recommending dried fruits because it's so easy to get big portions and a lot of carbs compared to a fresh fruit that has a bigger volume.
Thank you.
You're very welcome.
Michael, you have your hand up. Michael Foxworth.
Oh, yeah, I put some questions in the chat. I picked one out. There's a 1989 Atlantic Magazine article that says, quote, "Diet has hardly any effect on your cholesterol level. The drugs that lower it, like statins, often have serious or fatal side effects, and there's no evidence at all that lowering your cholesterol level will lengthen your life." And then,
okay, so
and the
Mike,
corollary,
1989 is so far away. You know, before
well,
I get to the.
I've read other
Yeah.
studies since
Here's the
then.
thing, we have, so what I said is based on a study that they've done, and we do have a diet as a result of that. We call it, I guess, lifestyle change something. So they did a thorough study for years, and we know, even for the diabetes, for any health conditions, this is how we go. We go first and foremost with lifestyle, then we go for the medication. With the lifestyle, you can bring the cholesterol, but it is very hard. Remember that I told you about saturated fat and limiting the cheese and animal foods and coconut and things like that. It needs to be you need to limit your saturated fat to 5 to 6% a day. And that 5 to 6% is very, very hard. I give you an example. So let's say someone like me, I need to keep my saturated fat every day to under like 8 grams a day. A slice of cheese, 1 ounce of cheese, has already 5, 6, 7, 8 grams of saturated fat. So if I have that one, I'm done for the day. So with many of these people, we need to do these extreme changes in the diet for them to work. So diet works, but it is hard, and not everyone are capable of doing that.
Well, my response to that is that there have been studies since then, and the studies show that that yes, you can reduce heart disease, that is, people dying of heart disease, by taking statins, but you don't increase their life expectancy. In other words, they die of something else. And I pointed to that one because it just happened to be the first one that popped up when I was looking. But there are other studies since then, and they're having a hard time showing basically that restricting saturated fats in and of itself. The problem with saturated fats, of course, is that they're high in calorie, and if you eat a lot of them, you don't have a balanced diet. That's a problem. In other words, the problem may be people don't get balanced diets. If fruits are expensive, people tend to eat sugary foods. They just don't get. They tend to get foods that are low in fiber, and I think I just wonder really whether we have demonize saturated fat excessively.
We did not. We have enough studies and we have enough evidence that shows that's the factor. So we did not.
Yes.
And here's the thing. There are some researchers out there, and actually one of them, he was the head of one of the really reputable schools. He did a study. There was some major issues with the study, and even his prof said he made a mistake. But because he was a cardiologist, he didn't admit that he made a mistake. And he published it, and I saw him, sometimes he comes on NPR and places like that, and he spread that same mistake over and over again. So no, we have enough evidence that shows that it is issue, and American Heart Association agrees with it, and then they updated their guidelines and their recommendations every year, and we still see to this date is saturated fat is an issue.
Okay, thank you, Mary Ann. I got another hand up.
Gordon.
Peggy.
What about Gordon?
So, sorry, I have yet to learn how to get a hand up in Zoom. Though I've Zoomed probably 25 times, so maybe at some point later on. But so 25 years working in oncology, I think your presentation was very applicable to what oncology patients are dealing with. And I think your presentation is very accurate. It's really well done. So I want to say that. But, you know, we talk about studies and statins, for example. So I got a message from my primary care physician saying American Heart Association and some other organizations that recommend statins. So I went and did some research. I looked at some studies. The major study that recommendation that came out several years ago, if you looked at the physicians that were involved, that were paid by the drug company, I emailed her back and said, you know what, that's not a valid study for me. I don't rely on it. So she said, fine. Anyhow, we talk about studies, and I'm coming to a question. So there was a study not long ago that said that vitamins, well, it really doesn't make a difference. The what do they call it? The complements, from the in NIH, the alternative therapies, all those kinds of things. A lot's come out on that over the years. A lot of question about whether or not they're effective. So my question is, in terms of studies, so we hear about a study. Where do we go to really take a look at who did that study? When was a study done? How many studies that have done some good sampling and have found similar results, so that we can rely on the source you're sending us to, PubMed or John Hopkins or whatever, and feel that we have some confidence, rather than, oh, this study said, that study said. I don't know what that means to me.
So Gordon, on the supplement one, I put two resources. One was for NIH and the other one was PubMed. So those are, PubMed is the best one for any medical research that we can look at. And those are evidence-based, meaning the expert in the field at least take a look at it. Still, there might be some research that one research is opposite that everything that we have for 10 years. Give you an example. There was a red meat research. They've done it this last year. And they came up with saying that red meat is good and everything else before was wrong, because they were not done what we call them gold standard in the research, that is randomized clinical trial. Okay, here's the thing. They've done a randomized clinical trial for a red meat. That is dead wrong. And I tell you why. The expert on this research were pharmacists. They run the study very much like a medication trial, not like a nutrition study. And with nutrition study, it's not like a medication that you get a lot of dose on daily basis and see the effects. It's a food that you're getting over the years and you see the effect over years. So we need to look at them differently. That being said, you're right. So PubMed is one of the best one that I use. When I was writing this presentation, I actually looked at some of the resources and some of the resources that Joanne gave me. So let's say one of them used Livestrong as their reference. And I was thinking, seriously, now I have Neil Armstrong suggesting people what to do for their neuropathy. So I'm just saying that sometimes we have to look at where they come from. Most of the stuff that I put on mine is from NIH. At least they have some reputation. They are better people. I also use Harvard a lot for my resources. Or let's say American Heart Association, like a Mediterranean diet people that they do a lot of work through European Union and the Harvard people, and they are based in Boston. So, but again, you need to be in the field to know how to basically differentiate. And even when you're in the field, I was not taught until I was at the PhD level what to pick as a good research and how to look at them and what is a good level study, what is not. So I'm just saying it's very hard. I don't expect everyone to know. I do have people that they come see me and I tell them this is the right way to do. And they start arguing with me and sending me research or resources from YouTube. And what is the other one? Any of these social medias. And they argue with me, look at this person, it says opposite what you're saying.
Yeah.
How I'm going to respond to that is like, I didn't get my doctorate on YouTube.
Terrific.
So
Terrific. Yeah.
it's very hard. And then when it comes to the supplements, especially, there's not that much money into it. So they're not funded very well. Many times we are lacking enough studies. They might be 1 or 2, 3 if they are very famous. Let's say turmeric is one of the ones that we have. For some, we have 0. And people Google things, they decide this is their elixir to use and be. So I'm just saying that many times we don't have enough evidence and studies for everything. And then I would say use an expert or a specialist that know their field.
Peggy, is your hand up or did you take it down from being
No.
tired?
It's up. Just to clarify, did you say that with dairy products like milk and butter, whatever, you can't absorb the calcium? I'm talking about unfortified.
You
Like,
absorb it, but you lose it through the urination, the same amount that you're getting it.
oh, as opposed to vegetables where you don't lose it the same
Not
way?
as much,
Oh.
correct. And that's because of their protein. Because of when you're basically losing their protein waste, you're losing calcium along with that.
Oh, wow. So even like raw milk, it doesn't matter if it's dairy, you're losing it the same.
Doesn't matter, it's the dairy.
Wow.
Okay, thank you.
And there's another problem with that, but you want me to get there or is it good enough so far? So the
Okay.
dairy products come with the growth hormone.
Okay,
When
we
it
have time.
happens-
We have
Say
time
it
for
again.
one more
One-
question. Is there one more question?
Okay,
or-
let me not to get to the growth hormone and dairy.
Oh,
Okay.
okay.
Karen,
I have a question. What are your thoughts about alpha lipoic acid?
so what is your thought about alpha lipoic acid?
What is what?
What have you heard about it?
Good for neuropathy.
Mhm.
Even by my pain management doctor told me to take it.
Okay, so let's talk about the doctors. Show me the evidence. I
Well, I
didn't
just
see any
asked you what
evidence.
your thoughts were. That's all. I just asked
So-
you what your thoughts were.
Karen, here's the thing. Sometimes the doctors might know more than I do. There are sometimes the doctors surprise me with their knowledge, but I don't know, and I haven't seen when I was putting this thing together. And most of my stuff came from NIH. They have a website for peripheral neuropathy, and there was no mention of lipoic acid on their website.
Nothing.
So if it's something good for the pain, I haven't seen as part of the management for the neuropathy, to be honest with you.
So you're saying that just the Mediterranean diet is recommended for peripheral neuropathy. And I in particularly have small fiber neuropathy.
So
So-
what they don't say Mediterranean. They said basically you need to have a diet that needs to be anti-inflammatory, and the most anti-inflammatory diet that we have is the Mediterranean.
Gotcha. Thank you.
Not a problem.
All right, Miriam, we thank you. There are many questions we may have not answered, but I do want to say one thing that many people have different metabolisms. We all have different doctors. They all favor Group A behind Group B. You know, you got to just, it's a journey. You find out what works for you and what doesn't work for you.
Sure.
We certainly appreciate Marianne being here and giving her speech.
Thanks for having me, everyone. I hope that you
Okay.
enjoyed the rest of your weekend.
Thank you very much. Thank you.
Bye-bye.
Very much. Thank you.
Stay,
Thank
you can
Thank you.
stay if you want to, but it's a rowdy group, so,
I take off right now, but thank you very much for your,
okay, thank you for being here. I
invite. Bye-bye.
appreciate it.
not a
Bye-bye.
problem. Bye-bye.
Thank you very much.
This is Joanne. I'd like to say that Mary Ann's website is Eat Well Guru. And so you might want to go there if you have any questions, or if you want to contact her for whatever. eatwellguru.com, right?
Yes, yes. Thank you, Joanne. Thank you for mentioning it.
Okay.
And you live in Vienna, Virginia, correct?
Correct.
Okay.
All right.
So short drive up 95 for me in Richmond, which would,
You can do telehealth, just so you know, Bill.
yeah. Okay, thank you very much. I
Thank
appreciate
you.
it.
Bye-bye.
Thank you.
Bye-bye.
Bye. All right, now we're moving to Rebecca talking about the 2022 donation campaign. Rebecca, are you
Yes.
still with us?
I'm still, yeah, I've got a doggy that's having issues. He's got to go out to the potty every once in a while.
Oh, well,
We can relate, right?
yes.
Anyway,
Certainly.
my name is Rebecca Hotel. For those of you who are new and don't know me, I am the treasurer for this group. We have a wonderful member who has offered to match any donations for the month of November, December, up to a maximum of $1,000. I know some people just look at this group and think we don't have any expenses, but yes, we do. We have to maintain the website. We have to maintain, if we go the Cheddar Up page that Judd can maybe open up now or show that first page. If we have to go back to in-person trainings or meetings, we might need to rent a place to have it, or video equipment, that kind of thing. So we do have some donations. Scroll on down, Judd.
Is this the page?
No, I want to go to the main page.
You want to go to the fundraising page?
Right, yeah. Does
Okay.
it have the page that's got my name and address on it?
The match campaign.
Got it. Oh,
Okay, so if you go to this page, you will see my name, my mailing address. Some people prefer to write a check and stick it in the mail. That's my mailing address. Or you can click on this Pay Now with Cheddar Up, and that you can put your a Visa card in or whatever, so you can get some so we can get our money that way. Currently, we have a total of $600 that has been donated. So if we raise another 400, we'll have our maximum. That would be wonderful. It has to be received before Christmas, December 25th. And with that, I will say Merry Christmas, Happy Holidays. I read somewhere that from mid-November to mid-January, there are 24 religious holidays throughout the world. So regardless of what your religion is, Happy Holidays. And for those of you like me who have a December birthday and always gets forgotten, happy birthday.
Happy birthday to you as well.
Thank you. Thank you, Rebecca. Pat,
Happy
you have your
birthday.
hand up?
Yes,
Pat,
I just wanted to add that we have had some discussion among ourselves on the executive team about the question of why do we need additional money and what is the fundraiser really for? Rebecca has noted a couple of things that we might use the additional money for, but one thing that I would like to say is that we have had contacts from other groups like Pittsburgh and Bethesda Chevy Chase. And we would like to support those groups and a new one that may be forming in Newark. And one of the ways that we can support them is by sharing these recordings of our presentations. Many times a group that's just getting started doesn't know how to find speakers or doesn't have the volunteers or whatever. And if we are able, there are some thoughts at least that we might buy some additional equipment to polish our recordings and make them more professional looking and sounding. Like I noticed that we forgot to start the recording at the beginning of this session today, which is unfortunate.
Sorry.
No, it's okay, Judd. It's not just your responsibility. It's a simple thing. And yet when you forget, Joanne is partway through the introduction of Dr. Dowka. And so what I'm trying to say is maybe with some additional equipment, maybe with some better Zoom facilities, we might be able to reach even more people. And every month we get emails from people saying, I really enjoyed the support group. I wish there was one locally that I could go to in person. People like the social interaction. And but we're grateful for Zoom because it has allowed us without geographic limits to entertain and host people from all over the United States. So we've had a generous match offered, and I know people say, oh, I intend to do that. Think about maybe going to your checkbook or Cheddar Up and know a password is not needed. Is that correct, Judd? For Cheddar Up, you just click on the website?
What you mean to contribute?
Yes. Someone
no, you can go right there, but it does require a little bit of information.
Yes, but it's not a password protected, but it is secure. No. But I just wanted to explain a little bit about what we're trying to accomplish here. Our goal with the network is to allow more people to get the support and hope that we hope we're providing to you. And that's why we're having this end of year plea for your support. Thank you.
Okay, thank you, Pat. Okay, now I'm going to move to.
Can I
Wait a
just
minute, I
add-
want to know
can I
why
just add
Rebecca,
something
Joanne,
from a
do you have
fundraising
any?
standpoint? Can I
I
make
know
a
you
suggestion?
mentioned about the future meetings and journeys that we're going to take. Would
Right.
you like to add to that or what?
Yeah, I would like to add to that. Our January meeting, I believe it's January 7th. And I think it goes without saying that we all have our frustrations with having a chronic disease like PN and not knowing that there is no cure and few effective treatments. But what I'd like to do in January is to invite all of you to participate. Some of you might want to get in touch with me first, but I think that like with all negative things, there's also sometimes a positive thing. And I would like us to share with each other some of the positive things that have come out in your life because you have PN. And for example, you might have made some new connections with other people that also have PN. Like I found that working with the leadership team has been a very positive and rewarding experience. You might have replaced an activity that you had. Maybe maybe you used to bicycle through the hills and now you have to stay on flat terrain, or maybe you even have to go to the gym and just use a stationary bicycle. Maybe you've gotten into some bridge or knitting or something else that you had not done before because you had a more active lifestyle. But what I'd like to do is instead of coming with our complaints for this one night, let's resolve, or for this one meeting, let's resolve to come with a very positive experience that you've had. And if you have some good news to share from your life that has come out of your, your diagnosis, I think that would be a good way to start our year with this support group. So anyway, let's resolve to look to 2023 as a year of finding more positive aspects of living with PN. And that's it.
Thank you, Joanne. I want to recognize, or do we have any new members in this group? I see a lot of smiling faces. And I see Santa Claus at the bottom, but he's resting Rodney Smith and ho, 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 and Merry Christmas. And
This is my first time here.
are they first time? Okay, Karen,
Karen.
go ahead.
First time, Karen, did you say that?
Yes,
You want to just say your name and where you're from?
Say
and
your
a little bit about
name.
you?
Say your name and where you're from, and had you hear about us, and tell us a little bit about.
my name is
what-
Karen
what-
and I'm sorry.
Go ahead. Go ahead.
My name is Karen. I'm from New York. And I found out about this group through another chronic pain group person.
Okay, welcome.
Okay.
Welcome.
You're suffering from what type of neuropathy do you have? And
I have small fiber neuropathy.
okay. Are you seeing a neurologist or?
Not currently, no. I've been through them and they can't help me.
How long have you been diagnosed, Karen?
The actual diagnosis was in 2015 from a punch biopsy.
Hmm. So you've been dealing with it for quite a while.
Much longer than that.
Mhm. Have you, do you have questions for this group that you are particularly interested in today?
Just wondering if, I have widespread neuropathy. I mean, it's from head to toe now. Just wondering, I've tried many, many treatments. If anybody's had any success with anything, I'd like to hear about that.
So I guess I have a quick question regarding that. So I also have head to toe neuropathy. Is yours, do you know what's causing your small fiber? If it's like autoimmune or?
It's not autoimmune. Right now, I was told it's idiopathic, but I think it's because I've had impaired glucose tolerance for like 15 years. That's what I think. One doctor says it could be, another doctor says no. So,
Well, Karen, I can tell you that I've had idiopathic neuropathy for about 15 years, and I know, I feel for you, I understand, and it is a journey. There is no magic bullet, but we have to keep staying positive and find the doctor that gives you some compassion and help. And as you said, I've been to neurologists, or you said, and nobody helps me, but I would just keep trying to find the right doctor, and I'm sorry.
I've been
but
to so many, I've been to all over the place.
Yeah.
And, it's just like, one neurologist told me in Manhattan, he said, come back to me when you're no longer able to walk.
Yeah, well,
I literally said that
I
to
think
me.
the majority of us have heard that, and it's a shame, but that seems to be what's going on. Lou, you had your hand up, Lou Mazaway.
I have my hand up.
Lou, you gotta unmute.
And then Gordon has his hand up.
All right.
No, I was really saying, I mean, I had the hand up to applaud what you said about that. Everyone, that was why, has to find, try to be positive, find someone that gives you at least comfort. And I think one of the neurologists that we work with at the Foundation for Peripheral Neuropathy, and you probably know her from a lot of the webinars, and she's in Manhattan. Her name is Shanna Patterson. She's at Mount Sinai over on 65th Street or whatever it is near Lincoln Center.
What's her name?
Shanna, I'll put it in the chat, Shanna Patterson. Yeah, that's it. Thank you. She is just one of the not only is she knowledgeable, but she's got her bedside manner is like A+. So,
Well, I saw one 2 years ago to see if I was a candidate for IVIG, but I was not. And she did
Yeah.
another complete workup like I've had in the past.
yeah,
And, you know, she just really didn't offer much because of the medications I've tried. I do not fare well on medications due to the side effects. I just don't.
yeah,
So
that may well be. I mean, I'm just saying, yeah, it sounds like you've been through a number of folks, and she may not be able to help, but I really think highly of her. That's
oh no,
all.
I'm going to write her name down for sure. I'm just
Yeah.
looking.
Yeah.
Okay, well, keep coming to this group because we are very supportive and caring, and we're trying to help each other, and we all give different advice, but we've all heard this before about physicians and medicines and supplements and this and that. And no, that didn't work. So just keep the faith. Yes.
Can I
go ahead.
Oh,
Rich?
Karen? Yeah,
Rich?
Karen, I wanted to, for those of us who do suffer neuropathy, yeah, we know there's not a silver bullet, but there are certain things that can take the edge off. And if you, so at this point, I think it's good for you to know that the website for Peripheral Neuropathy Support Network, just asking, have you been there? Because there's a resource tab. If you haven't been there, you may want to take a look at that because it is nice when you can take the edge off.
Oh, that would be really nice.
I mean, it talks about, like one thing I'm on that takes the edge off, it helps me sleep at night, is gabapentin. So I don't know, if that's something you're familiar with, but
Very.
Okay, good. Yeah, I assume you probably were since it was pre-2015, but there's a lot of other resources on there as well, different things that.
Yeah. Thank you. Appreciate it.
Rich, could you please put
So-
that in the chat, the website address that you're referencing for other people?
Will do.
And Gordon's been so patient. Can we hear?
I'm
from
sorry.
Gordon?
Okay, go ahead, Gordon.
So like Bill, Karen, I've had neuropathy for 15 years. Actually, I found out this year, I finally got to meet with a neurosurgeon who was really excellent. He gave me a 45-minute evaluation. He said, you have polyneuropathy. It's a disease. Guess what? I never heard that from my neurologist and the department that they have. He said, most neurologists, he says, what you've got is a subspecialty. Most neurology are not going to know how to properly diagnose and treat what you've got. You need to find somebody who basically has that expertise. He's going into private practice with an Nova Health system, but he did say that most neurologists really are not qualified to deal with what we've got. So take a look at a neurosurgeon. That's who I got to. And I finally found out a lot more about my disease. But quickly, I want to say in terms of fundraising, something I did for a living. So I wanted to donate, right? So I went to, what's this, Cheddar, never heard of Cheddar, called one of your members to find out more about it. Well, apparently it's an organization that's used to buy sporting equipment, right? Well, I have Zelle and I also have PayPal. So I thought, you know what, I am not going to sign up again to connect to my bank for another organization. So is Cheddar the right organization that you guys really want to use to solicit contributions? Writing a check this time of year, because we make other contributions, is a royal pain, frankly. So the other thing I'm going to say, and since I sound so nasty, is everybody ought to be not mandated. Everybody should contribute. This is a great organization. They bring in wonderful, helpful information, resources. Everybody should make at least one contribution, be it $5, be it $100. You need to do it.
Gordon, I appreciate, even though you're a little bit nasty, I appreciate how you ended your conversation.
Judd, could you please respond to Gordon's question about Cheddar Up?
Well, there are hundreds of technology companies that are out there. Just because you hadn't heard of it doesn't mean it's not a good resource. You and I talked about that.
Yes.
And
sure.
let me say that, I mean, Cheddar focuses on nonprofits, not sports goods. What I was giving you is an example of the Little League it's a nonprofit group. They're trying to raise money, and it would be the same with any. They just focus on nonprofits. That's what I'm saying. But they handle
Gotcha.
millions of dollars a year.
Okay.
We're pretty confident that they're handling it right. Now,
Okay.
like every other one of these operations, they charge 3 or 4% for their trouble. And
Right.
so, I mean, your Visa card does that.
Yeah.
So we have to pay that. But no, it's a good. Unless you can tell me differently, we've had real good luck with it. And the good thing about Cheddar is it doesn't make you join. Like if you were to sign up for another group, it would make you sign into their database.
Right.
And we would have your information. We don't do that. We have about 3 or 4. You got to give your address, your phone number, your email, and then your credit card number, and then boop, you get that. It doesn't require anything else, and it's totally separated from our membership list. So I'm real confident about Cheddar. If you have some inside information, just let's talk again. But
you might want to do a survey at some point, ask people what they use, and find out what percentage of people use Cheddar or PayPal or Zelle or something else. You know what? That could be useful information.
Yeah, Zelle wouldn't be appropriate. Venmo wouldn't be appropriate. The other things, PayPal is okay, but that again. I don't know how many people use PayPal. I use it all the time, and it's it gets you involved. And I think do you use PayPal, Gordon?
Yeah, I'm already in it, so I don't have to add.
Okay, yeah, see, you're already in it. That's the problem. Everybody's going to have their favorite, and they're going to say, I'm already in it. What we did was choose one that wouldn't require you to give over all your information just to make a donation. That's the thing. PayPal would be convenient for me too, but because I'm already in it. But I would be hard pressed to talk some people into going with PayPal, because it is very invasive.
All right, Judge. I'm Judge Gordon. I'm just going to sort of y'all could talk separately.
Yeah, we'll fight later.
I will tell you, it's a great thing to do. Even though we're all nasty at some time or whatever, I'm going to write a check. That's what I do.
There you go. Good.
Anyway, okay, we're going to wrap up here. And
Karen has her hand up.
Thank you. I just have a quick question.
Yes, ma'am.
It's not about donations.
Okay,
It's about
good.
nerve stuff.
Good.
Nobody's been nasty. Just a little spirited.
We're rowdy.
Anyway,
we're rowdy.
That's fine. Listen, I just want to know, does anybody have anything called pudendal neuralgia in this group?
Again?
There's a pudendal nerve that has gotten affected in my situation. Does anybody have pudendal neuralgia?
It's in the face. Where is it? The face?
No, it's down low.
Could you spell that in the
No.
chat?
I have not been diagnosed with it, but that would make a lot of sense in my case.
Is it
I
in
got
the
you all.
chat, by the way, Karen?
I just put it there.
Great, thank you.
Yeah, it's a pudendal. It's a nerve. It's called
Okay,
a pudendal nerve, and it
We
affects.
can certainly look into.
Well, you don't have to look into
I
it.
don't.
I just wondered. Yeah, somebody put it in there already.
In my
Shannon
case,
says-
yes.
Shannon says in the lower buttocks. Interesting.
Well, it's more than that.
I'm sure it is.
Yeah, like in the
And
hip
it's
especially and all of that too. And in
and it's not funny.
no, it's
It's really it's
Painful.
ruined my life. So it's ruined my life. So that's why I was asking. Okay, thanks,
Yeah, I'm
guys.
reading it now. And ooh. Sorry for it. I didn't mean to smile.
No, it isn't. It's not
Oh,
really fun.
No,
You
I've got you loud and clear.
Yeah, it's ruined my life. So, okay, and
Okay.
I'm sorry. What was your name? The girl that was just speaking.
Shannon,
My name is
no,
Shauna.
Shauna,
Hi,
excuse me.
Shauna.
Hi there.
Shauna, thank
Shauna,
you
why don't
for,
you send me your phone number, like privately, and I'll
Yeah.
give you a call, all right?
Yeah, that's fine with me. It'll be an
Okay,
interesting area code because I'm actually in Illinois. So
that's fine.
thank you very much. That's a great connection. That's a part of what we do. You know, some person has some, well, we have two more hands up, but Margie,
It's
gotta be
just,
quick.
it is quick. I just wanted to know if Gordon would be willing to share the name of the doctor at Inova, even in a private message, if this is not something that we do.
Yeah, no, for sure. Absolutely. He did all his studies in New York. He's got terrific academic background. Dr. Choi, Choi, I believe is the spelling. Unfortunately, before we end, I could probably find his first name, and he's, you know, Choi is the, I have a daughter-in-law who's Chinese, so I don't know. He's, whatever he is, you know, he's.
He's
what
a
do I say
neurosurgeon?
now? He's like,
He was the neurosurgeon?
he did all of his studies in the United States. Let me put it that way. He's a neurosurgeon, and by far, I mean, I frankly, the neurologist I've had for years has been useless. You know, I kind of told her that. She said, if you want, you can see a neurosurgeon. My one exam with him after 45 minutes, what he said is, you know what, most neurologists, most departments do, this is a subspecialty. It's very specific. There's not a lot of folks out there that understand it very well. It's amazing what I learned from him. So yeah, he's leaving he's leaving the healthcare organization he was with in Falls Church, the Virginia area, because after a year he said, no, I'm done with them. So he's gone back to Inova, and he's in private practice now. Could probably find him on the internet, because I said, look, once you're in private practice, because I'm with Kaiser, I want to go see you. So, but let me see if I can get a name before you guys say goodbye.
Okay. Peggy, you had your hand up?
Yes, you had asked who was here for the first time, and I am, but I guess we're out of time now, so I won't go into detail right now.
But we can,
Can I make a comment before everybody starts clearing out? Some people don't seem to understand how to operate chat. And I've been asked for my address. It's Rebecca Hotop, HOTOP, 10639 Canterbury Road. It's BERRY, Fairfax Station, Virginia, 22039. The check should be made out to PN Support Group of Metro DC. Thank you.
okay, Pat, would you like to wrap up?
Yes, I would. Thank you. I'm going to hopefully share my screen. Let me do this, please. And in 1 second, we should be ready to go. Okay. Can you, there we go.
Joseph Choi. Joseph Choi.
Joy. Okay.
CHOI.
Thank you, Gordon. And
Yeah.
while Gordon is still available, I would like to ask people who have just their first name in their participants list or on screen, if you could add your last name, it really helps us in keeping a record of who has participated, unless you have privacy issues or concerns and you do not want to share it. Of course, we understand that. Okay. For example, I don't have Gordon's last name or Karen's last name. If you are willing to, we would appreciate it.
It's there.
As president of the Peripheral Neuropathy Support Network, I just wanted to take this moment at the end of the year to acknowledge and thank the people who have been tirelessly working towards keeping this organization functioning, not only functioning, but efficiently and effectively. And the first certificate of appreciation is awarded to our executive team, composed of Judson, Bill Porter, Joanne, Michael Foxworth, and Rebecca Hotop. The executive team meets every Thursday, and we discuss and work through problems and issues and make sure that everything is going smoothly and working out problems. So we appreciate all of these people's incredible amount of time that goes into keeping the organization running. Judson, Bill, Joanne, Michael, and Rebecca, I thank you. The next certificate of appreciation goes to a group of people who volunteered, members who volunteered to take on a task of updating the peripheral neuropathy database. And this was an incredibly involved task. What they did, the three of them, each spending like 25 hours contacting everyone on the more than 400 people on the database, either by phone or by email, to connect with them, ask if they still wanted to be a member, asking if they had particular questions. Jerry Piazza, in fact, has put people in touch with other people because of questions that were asked of her. So I give this award to Jerry Piazza, who unfortunately isn't here today, Gil Porter, and Judson Vaughn. Sorry about that. That was an alarm going off in the background. My final certificate of appreciation goes to Peggy Vaughn. And you notice the similar last name. Yes, Peggy is married to Judd Vaughn. And I'm awarding this to Peggy for sharing her knowledge and expertise in the design and formatting of our 2022 annual report, which you can download and read off of our website. Peggy is an incredible experienced person in nonprofits and helped us not only with the annual report, but getting our 501c3 affirmations. So I really, again, thank Peggy Vaughn for her work with us. In addition, there are people like Terry Orlando and Lou Mazaway, who I wanted to recognize, who helped with the kickoff for Dr. Greg Matheson's work going cross country to raise awareness for physical therapy. His work across the country, raising awareness for peripheral neuropathy and also funding. That was Terry and Lou Mazaway's efforts. I'd like to thank Rich Davis, who moderated our marijuana panel, and any of the members here who participated in that. I sincerely appreciate the work that you put in, and we're going to do a follow-up. It was so popular. We're going to do a follow-up in the coming calendar year on marijuana. And the third group that I want to acknowledge is David Bush, Judson, Mike Foxworth, and myself, who joined with a consultant who pro bono helped us, Gary Vaughn, who helped us with our platforms, our social media platforms, and improving our presence there. I know there are many, many people who have participated and helped, and I see you in the audience. I'm sorry if I didn't remember. Peter Coro hosted our holiday party last year. Brenda Cheadle often tells us about articles that she's read. So it is a caring, involved community, and I appreciate all of the help that you have participated and given us this past year. Thank you.
Thank you.
Thank you, Pat. I appreciate the check in the mail. That was up to love.
That's what he's really going for.
Anyway, I wish everyone a happy holidays and a Merry Christmas, and we look forward to seeing you again in January. And
Yeah.
I appreciate all the input. And
I want to speak to Rebecca and after this meeting, and Pat, please stick around.
Okay.
Well, and I just wanted to say thanks to Pat. Pat, you have been the glue that has held us together, and I know we all appreciate that. Thank you so much for everything.
Oh my
Yeah.
God.
Thank you.
Hey,
Thank you to all of you for everything you've been doing. You really work hard for us. Thank you.
And we hope to even work harder in the calendar year and welcome new volunteers. Terry, we just gave you a certificate of appreciation, but you were just 2 minutes late, but
Oh my God, how was it? I really wanted to come to this.
it
How was it?
It was good.
It was great.
Good. It was a good presentation.
Did you record it? Like, can I watch it?
Yes.
Yes, it will be posted to the website for sure.
Okay, because I was like, I'm gonna come to this one, and then I got home from grocery shopping. I was like, oh, maybe they're still there. It's 4.
Well, good. And as we said, because Dr. Deck agreed, the slideshow will be on our website as well. Sometimes we don't get notes taken and we want to go back and review it. So both the slideshow and the recording will be available.
How did you, I know you guys have been on for 2 hours. I'm so sorry. Is this person local or a national nutritionist, or just curious?
Joanna.
She lives in Vienna,
Oh,
Virginia.
Vienna. Oh, nice.
And she is available for consultants.
And her website is Eat Well Guru, correct?
Well, Guri. Oh, thanks. Cool. I'll
Yeah,
have to
if
check
you,
it out.
we heard about Google today. If you Google her name, a lot of stuff will come up, so.
Okay.
She's not a fan of Googling.
I know, that's why I say that tongue in cheek.
Don't
Just
Google her.
don't eat
well,
too
Guru.
much over the holidays. Eat in small plates, small plates.
Is that what she said?
I will follow up with Gordon on Dr. Choi, because we can put him in the database on the website, and then everybody will have access. We have a database of providers.
Yes.
So
Was it generally don't eat carbs, don't eat sugar type of thing?
Folks, we've run out of time. I'm gonna have to leave. Peter wants to talk to Pat and me, so I'm sorry. You're gonna have to ask some other time, okay?
All right. Well, all right. Bye, guys.
You got a couple of hours.
Merry Christmas.
bye-bye all.
Merry
Thank
Christmas.
you.
God bless you, everyone.
Merry Christmas.
Oh,
Merry
Thanks,
Christmas.
Rodney.
Okay, don't
Good
shut
to
the
see
entire
everybody.
thing down, Judd, so Peter can talk to Pat and me.
Okay.
Okay, well,
Gordon, I'll give you a call.
Yeah, that'd be good. He also got me to a genetic test also, told me all about it. I've been tested. He was the only one that told me that. 15 years of my neurologist never mentioned it.
Wow.
Yeah. And it's a big topic. Yeah.
All right, see you guys. Happy holiday.
Okay. See you. Bye-bye. Same.
Okay, Pat, you look in the notes, save your notes. I've been talking about Rebecca volunteers at the Lamb Center, and I go there myself. And I gave her a check for $200 on Tuesday. And I asked her how much did she already have, and she said $200. So I presumed that 200 for 200 is what? 4 plus 4 is 8. I don't understand what's the discrepancy, and I would like to have.
okay, all right, I see what you're doing. Peter, I'm giving you the total number that we have received. When that total gets in, then we will double it. It hasn't been doubled yet.
Oh, well, so in other words, it's still it's not followed. And I had no idea when I saw $600, and I knew it was supposed to be $800. That's my concern.
No, it's $600 now, and when the person who wants to match it writes their check, it will become $1,200.
Okay, thank you for the information. I think you should tell everyone that when you show how much we have in case they donate and it's not the correct number, tell them that wait, because it has not all been recorded yet. That's important for them to understand.
We're not going to total it until the very end, and then the person's going to double it.
I think Peter also has a good point. The thermometer is only showing the donations, not the match. The thermometer is trying to reach 1,000. If we reach 1,000, the person who offered it will match that 1,000 for 2,000.
Thank you for the information.
Yeah, we don't want to show that person's match because we're trying to get other people to donate also.
Okay.
And if it all of a sudden hits 1,000, people are going to go, oh, it's done.
I got you. Thanks.
Okay.
Nice talking to you all.
Okay.
Thank you for asking for the clarification.
Yes, exactly.
We don't want anyone to think that we're absconding with the money and going to Bermuda for Christmas.
You can't get much money out of me for that.